Hi, we're here to share information about our article, Culturally Adapting Relational Savoring, a therapeutic approach to improve relationship quality. Relational savoring is a brief prevention or intervention approach that involves identifying a memory involving close, positive connection with another person, and then deeply focusing on that memory. Relational savoring can be delivered as a standalone intervention approach or integrated into other intervention approaches. It has been delivered to various populations, including parents and romantic partners, but the majority of the research that we've done has been conducted with parents. Relational savoring is grounded in principles of attachment theory and positive psychology, and it's most typically been delivered in the individual therapy context.
As we've expanded our work with relational savoring and gained new community partners, we have become intent on ensuring that communities reached are receiving a culturally congruent therapy. Culturally congruent care aligns with and is responsive to clients' inner and outer worlds, such as their beliefs, cultural values, and practices. Acceptability and accessibility are two key ingredients of cultural congruence. And in this paper, we share several studies in which we made adaptations towards these qualities.
We began our research on relational savoring by implementing a version that was not culturally adapted. The parent study was a randomized controlled trial that examined the efficacy of relational savoring among mothers of toddlers, focusing on mother-child relationships. The study sample included 41% Latina participants. Although cultural congruence was not a primary goal, our findings show that the intervention may have been particularly acceptable to Latinx families. For example, we found that the narratives generated by Latina mothers demonstrated connectedness and positivity within relationships. This may be because the focus of relational savoring aligns with cultural values linked to Latinx cultures, such as familismo and simpatía.
The Confío en Mí, Confío en Ti study was developed in close collaboration with Latino Health Access, a community health agency to meet the needs of Latina mothers and their children. Through a community-based participatory research approach, promotores, agency administrators, and psychologists co-developed an 8-week intervention program that incorporated relational savoring as a key component. All intervention components were adapted through an iterative process that involved community member feedback. The resultant intervention was delivered by promotores, trusted community members, and incorporated local metaphors in order to resonate with cultural values.
Most recently, the focus of our intervention work has been on a different kind of care provider, community health workers working with low-income Latina communities. We worked closely with community health workers to elicit feedback around the relational savoring intervention and inform adaptations. To improve accessibility, the intervention was delivered virtually by paraprofessionals. To improve acceptability, we reimagined safe haven and secure base dyadic relationships within the context of the caregiving relationship between community health workers and their client community. We also transitioned to a remote telehealth delivery model and offered all sessions in Spanish.
In conclusion, our initial work in culturally adapting relational savoring for the Latine community has revealed the promise of this approach, both in terms of the inherent fit of this intervention with the cultural values of these communities and of the benefits of the modifications we have made. The adaptation process has also revealed potential areas of focus for future adaptations, such as the ways in which emotion is conceptualized and the relationship focus within the relational savoring intervention. We encourage you to read the full article to learn more.